Today we're here to announce the indictment of two cases involving pill mills in three different Maryland counties. The first relates to two connected pill mills, Starlife Wellness Center in Anne Arundel County and Westside Medical Group in Baltimore City. The first case involves 10 co-defendants who conspired to dispense opiates and other controlled dangerous substances with no legitimate medical purposes and for the purpose of defrauding Maryland's Medicaid program. The defendants include Kofi Shaw Taylor, who is a physician licensed in Maryland. Now, a pill mill is a physician's office or healthcare facility that routinely engages in the practice of prescribing and dispensing controlled dangerous substances outside the scope of professional practice. In pill mills, practitioners sell prescriptions for opioids, typically for cash. They do not provide medical treatment. They don't conduct physical examinations, take medical histories, or keep adequate medical records. But they prescribe opiates, drugs that can cause addiction and death. Our indictment in the first case alleges that Dr. Shaw Taylor and other persons involved in the ownership and operation of the two pill mills prescribed oxycodone and other opiates alone or in combination with benzodiazepines or other narcotics in violation of the law. The conspiracy also involves Medicaid fraud. Claims were fraudulently submitted to Maryland's Medicaid program for office visits, supposedly with Dr. Shaw Taylor. In fact, at times he did not see patients. At times he wasn't in the office, and in fact, at times he was out of the country when these office visits supposedly occurred. Many of Dr. Shaw Taylor's patients traveled long distances to see him. They came from Ohio, more than 245 miles away. They came from Western Maryland. They came from the Eastern Shore, and mostly they were coming to get prescriptions for oxycodone. During the course of this investigation, a number of search warrants were executed by the United States Drug Enforcement Administration, from the U.S. Department of Health and Human Services, and from the Office of the Inspector General, and task force officers from local jurisdictions. At the pill mill locations and at owners' residences, over $90,000 in cash was recovered from the West Side location. The residence of Kofi Shaw Taylor and Tamarco Harris, who was the owner of Starlife and a co-conspirator. They also recovered a cash counting machine at the residence of Tamarco Harris. Approximately 1,083 Medicaid beneficiaries were prescribed medication that listed Dr. Shaw Taylor as the prescriber. 403 of those beneficiaries were prescribed 283,000 doses of oxycodone, with Dr. Shaw Taylor listed as the prescriber. Between January of 2013 and May of 2017, there were additionally 336 Medicaid beneficiaries who received prescriptions for the deadly combination of an opiate and a benzodiazepine. 2 of Dr. Shaw Taylor's patients died by overdosing on oxycodone, a drug that he had prescribed for them. The defendants also include 2 nurse practitioners who were authorized to write prescriptions for controlled dangerous substances and a lawyer barred in the District of Columbia who facilitated the scheme. I want to say special thanks on this investigation, again, to the U.S. Drug Enforcement Administration, the U.S. Department of Health and Human Services, and the Office of the Inspector General for partnering with us in the investigation of this case. Their involvement was absolutely critical to the success of this, and you'll be hearing from their representatives in a moment. The second case is much more simple and straightforward. It's the case of Hassan Babaturk, also a physician. Dr. Babaturk is charged with selling prescriptions for oxycodone, oxymorphone, fentanyl, and Xanax. Xanax is a benzodiazepine, often for cash and often directly from his car in Harford County. This case was investigated in partnership with the Baltimore County Police Department, and you'll be hearing from their representative in a moment. Kofi Shaw Taylor has been charged with 289 counts, including 2 counts of Medicaid fraud involving the death of a beneficiary. Those counts carry life sentences. Hassan Babaturk has been charged with 21 counts, mostly for distribution of controlled dangerous substances. Our state and our nation face an opioid epidemic in magnitude and scope that we've not experienced before. This chart shows you the dramatic increase in opioid-related deaths that we have experienced. You see a huge spike from 2014 to 2015, and an even greater one till 2016. Opioid-related deaths in Maryland have quadrupled since 2010. Last year, 2,000 people died of drug overdoses in Maryland, and in the first 3 months of 2017, 550 people have died of overdoses. This epidemic represents a challenge to us that cannot be addressed solely by arrests, indictments, and imprisonment. But when the epidemic is fueled by doctors, those whom we turn to in pain and in whom we trust, punishment is necessary. There were others involved here, but Drs. Shaw Taylor and Babaturk were using their skills not to heal, but to spread the disease of addiction. They enriched themselves by stealing from the state and by exploiting their patients. Today, they face the consequences. Now, I'd like to introduce next Special Agent in Charge, Carl Holder from the DEA. Thank you.
Thank you, Attorney General. Carl Holder from the Drug Enforcement Administration, Special Agent in Charge, the Washington Division. And I'll just echo the comments that were made before me, but I'll go a little bit more in depth. In 2015, over 52,000 Americans died from an overdose. More than 33,000 died from opioid use. In 2016, over 2,000 people died in the state of Maryland. The preliminary numbers in 2017 are just as bad. When licensed practitioners like the ones mentioned in the indictment fail to do their jobs, it leads to the epidemic we see today. We know that 4 out of 5 new heroin users start off by abusing prescription drugs or pills. Now, here's another startling number. We're 5% of the world's population in the United States, and Americans consume over 98% of the world's oxycodone and hydrocodone. So that in itself speaks for how important this investigation is. In 2015, DEA Baltimore began investigating activities of Dr. Kofi Shaw Taylor and his associates, along with our partners from Baltimore City, Baltimore County, HHS, and the Attorney General's office. The result of today's indictments show the DEA is committed to working with our federal, state, and local partners to investigate those who abuse trust given to them to care for the sick. And let me not forget about Anne Arundel County. Dr. Taylor's DEA license is in the administrative process of being revoked by DEA, and back in May, the state of Maryland revoked his license. So at that point in time, he was unable to perform his duties because that leads to DEA revocation. We want to make a point that not all doctors are to be seen in this light, because there are good doctors. This happens to be one that wasn't. In March 2017, Governor Hogan declared a state of emergency on opioid heroin abuse, and still you have this problem. And we are going to continue to investigate doctors who violate the law. I just want to echo again the numbers that you see here on the chart. It's startling. We continue to have this problem, but we're going to have to deal with it in a joint effort. I just want to take the time again to thank everyone here for the work and the effort. It's not one agency, it's all agencies, and this is one of the first investigations that we're really working with the Attorney General's office. I think this is a start. I think it's where we need to be, and we're going to go after anyone who abuses their authority, particularly those medical practitioners that are the gateway to this opioid and heroin problem. So that in itself is a goal that I have. This relationship is long overdue with the AG's office, and we're going to continue the relationship. And at this time, I'll turn the podium over to Nick DiGiulio from HHS.
Thank you. Hello, everybody. My name is Nick DiGiulio. I'm Special Agent in Charge for the United States Department of Health and Human Services, Office of Inspector General. I, too, want to thank the hard work of the working agents and law enforcement partners for yesterday's safe and successful search and arrest operations. And we look forward to supporting these cases to their just conclusion. Illegal diversion of opioids and healthcare fraud is a concern of everybody. Whether it's OxyContin, Percocet, diverted by healthcare professionals, or heroin and other drugs diverted by street criminals, these crimes are driven by one thing, that's greed. And the numbers show it. If you look at the same time that the opioid deaths are going up, Medicare billings just for Medicare Part D, one program, have gone, for that same 10-year period, from $1.5 billion to $4.1 billion, a 173% increase just for those commonly abused opioids. And our agents continue to see the same scenarios, right? In and out of the healthcare field. We're losing large sums of money by people looking to make large sums of money by selling these drugs on the street, and the results are disastrous. Increasing addictions, broken lives, overdose deaths, and a financial drain on our healthcare resources. Last week, the Department of Justice announced an opioid fraud detection abuse unit. And we're going to partner with everybody in this room with the goal of utilizing data to help combat this devastating opioid crisis. With this focus, we can use data to identify which individuals are contributing to the epidemic. We can tell which doctors are far exceeding their peers in prescribing these opioids. We can tell which doctors' patients are dying within 60 days of getting these scripts. We can tell which pharmacies are disproportionately writing and dispensing a large proportion of opioids. And the data can point us to the hotspots, to the pill mills, to the fraudulent Medicare providers, unnecessarily billing our programs for services not rendered, and billing for Medicare and Medicaid for illegitimate prescriptions. They can point us to medical identity theft and money laundering schemes. So today's announcement displays our continuing work of the dedicated special agents who are committed to fully investigating these cases and taking the criminal healthcare professionals out of the industry and leaving only the responsible, honest healthcare professionals to do their part in treating pain and treating opioid addiction. Thank you. Now I'd like to introduce Captain Wes Fisher from Baltimore County Police Department.
Good morning. I'm Captain Wes Fisher with the Baltimore County Police Department's Vice Narcotics Section. Here to talk to you about the case of Dr. Hassan Babaturk. Our investigation into Dr. Hassan Babaturk began in October of 2015. Dr. Babaturk had just been let go from a medical practice that he was previously involved in, and he began practicing on his own. Except unlike other cases we've investigated, his operation was much more like a traditional drug conspiracy. He would actually meet patients on the street, in back of parking lots, in vehicles. He was even making pseudo house calls where he would go to a residence. The owner of that residence would invite other people over for sometimes a cover charge, and Dr. Hassan, for about $300 in cash, would write prescriptions of what those people needed. So we started getting complaints from the community about more traditional drug activity. We got complaints from the business community, including information about prescriptions that were questionable. When pharmacies were calling to verify prescriptions, the doctor was available at very odd hours in the middle of the night, had no office staff. Those are some of the things that alerted us to the fact that this was a criminal enterprise and not an actual doctor trying to help patients. As the investigation continued, we saw that the people who were seeing the doctor were selling these prescriptions on the street. We began coming into contact more and more increasingly with defendants who had prescriptions from this doctor on their person. As our probable cause continued to grow, we identified a location in Harford County where the doctor was residing, as well as a medical building he had just purchased and was in the process of starting a practice on the east side of Baltimore County. So I'm sure had that been allowed to happen, there would have been some of the other issues you've seen, such as the Medicare and Medicaid fraud. Fortunately, we were able to intercede before that happened. So based on our surveillances, based on additional interviews with patients or clients that had obtained prescriptions from Dr. Babaturk, we were able to execute search and seizure warrants on his vehicle, his residence, and then his newly acquired office space. Some of the things that we seized were things you'd expect in a case like this, obviously. Drugs, drug paraphernalia. But what's more telling is what we didn't seize. There were no patient records. There were no documentation of the patients that he was seeing, that he was writing prescriptions to. This information wasn't properly documented so that another doctor would be willing to issue that same person a prescription. There was just no checks and balances there on the doctor's operation. We also learned through the course of our investigation that largely not just obtaining the proceeds of these prescriptions that he was selling, we also observed he was supporting his habit. He was using drugs and exhibited a lot of the same characteristics as someone that was addicted to opioids. And with that, reaching out as soon as we could to our partners, Baltimore City, Harford County was a huge help in this investigation. HHS, DEA, the Attorney General's office, everyone acted quickly to ensure that once we executed these search warrants and charges were pending, that this doctor was not able to continue their enterprise. They were not able to continue writing prescriptions. And that's one of the biggest things for us as local law enforcement, is having those partners to navigate those regulatory and administrative rules that doctors are held to. So it really was a team effort with these agencies that you see before you, and getting that doctor off the streets and to prevent him from getting more people addicted and causing more overdoses.
Thank you. Before we take questions, I just want to say thanks again, Special Agent in Charge Holder, Special Agent in Charge DiGiulio, Captain Fisher, and to the other law enforcement agencies that are here today who were instrumental in these investigations, the Anne Arundel County Police, the Baltimore City Police, the Howard County Police, and the Carroll County Police. And finally, I want to thank my staff, Elizabeth Embry, the Criminal Division, the Medicaid Fraud Unit, and the Organized Crime Unit of the Attorney General's Office. Are there any questions?
Is there a dollar figure attached to these criminal enterprises? How much money actually was?
Yes, the indictments detail some of the money, 200 and, Elizabeth, what do we have a...
Sorry, it's a little over 100,000 less specifically in the focus on the other case, but we can provide all of the indictments.
Yeah.
Just to clarify, Mr. Shaw-Taylor, he owned and operated both West Side and Starlight Wellness Center?
He, I don't believe he was an owner of Starlife, but he was involved in the operation of both. Any other questions? Yeah.
Mr. Attorney General, do you have a feel for whether these allegations, the activities of these defendants, fall under the category of, fairly routine, and for every one guy we get, there's 100 doing the same thing? Or are these outrageous cases? Are these really unusual, and do they anger you and the people around you?
I'll let these gentlemen speak for themselves. These are outrageous cases. We hope they're outliers. Unfortunately, the evidence in Maryland and around the country suggests that there are others like them, folks who seek to profit off the sale of opiates and who exploit their patients and cheat the state. But these are absolutely outrageous cases. Does anyone else want to comment on that?
Well, from my perspective, my area of responsibility is West Virginia, Maryland, Virginia, and the District of Columbia. So this in itself is an example of what's going on in this epicenter of the addiction problem. And so we're seeing this every day, not seeing this particular problem every day, but we're seeing it across the board. And it's a problem that we have to deal with. And I really think that this effort, this joint effort, is the only way that we get to solve this problem. So we're seeing it and we're dealing with it. The second thing is that it's not just the heroin that people are overdosing on. It's the prescription drugs. And this is a clear indication that people have died as a result of this practice, and in particular, Dr. Shaw. And so that's what we're seeing. We have to stop it at every level, and that's why this is so important.
I had a question for Mr. DiGiulio. If you
Yep.
could go back to the mic, please. Were these cases, you talked about data.
Yes.
Are these cases where data leads you to people committing bad acts, or is knowing what's going on in individual communities as big a factor in being able to bring indictments?
That's a great question, and it works both ways. I mean, sometimes the data will lead us to providers that are not on our radar. Most of the time, they're on our radar, but it confirms what we're looking at. We match the data up with the human intelligence that we're getting on the street from our state and local partners, and it just paints the picture of where the crime is and where the fraud is. To your point of, is this outrageous? And are we angry about it? We're absolutely angry about it, and we're outraged. There's a balance, right? A lot of good doctors out there trying to treat pain legitimately in the right way. But when we see doctors that are just nothing more than street dealers, that's when we become outraged. When they're only in the business to sell prescriptions for cash and have no regard for their patients whatsoever, they're the doctors we want to get out of the industry and get off the street.
You had mentioned opioid deaths. Were any of those during the investigation?
No, the investigation uncovered those deaths.
Okay, so they were prior to the investigation.
Well, the investigation went on for a while, so I can't say whether they occurred after it commenced, but the investigation went on for some time.
It mentions in the indictment that West Side attracted large crowds of customers, that started fights outside, disturbances and whatnot. Anybody who worked with that specifically, can you paint that picture for us and maybe shed some light on what a typical day would be like out there?
I think we're limited to saying what's in the indictment. All right. Thank you all very much.